Good morning. You're tuned into the Now Morning Show, the Wednesday edition. And in case you didn't know, November is Epilepsy Awareness Month. So, joining us this morning, the president and founder of the Seizure Awareness Foundation of Trinidad and Tobago, Nicole Van Der Poel, joins us alongside with Dr. Vanita Shuklal, the pediatric neurologist, to give us some insight on how we can observe this month. Ladies, good morning and welcome to the Now.
Good morning, and thank you for having us.
Let me say thank you very much for my pin, as I see you have walked with one for me so that I will not forget. Not only is the month of November Epilepsy Awareness Month, but the color purple is the official color as well. So I'll learn the memo and work the wardrobe next time. But first, tell me, as president and founder, what the Seizure Awareness Foundation of Trinidad and Tobago has been able to do since its inception in the country.
Okay, we have been in existence for 10 years now. This is our 10th anniversary this year. So we were founded to advocate on behalf of persons living with epilepsy in Trinidad and Tobago, of which there are over 40,000 people. We work with the Ministry of Education Student Support Division to go into schools to carry out what we call our Seizure Smart program, where we go and we teach seizure recognition and seizure first aid. So we also do conferences such as the one we have, and everything that we can do to promote epilepsy awareness in Trinidad and Tobago.
Well, with 40,000 persons in the country living right here in Trinidad and Tobago with epilepsy, it seems like something necessary.
Certainly.
And unfortunately, it might not actually be the case. There is a lot that we don't know, and I'm sure that as a pediatric neurologist, you are seeing the cases growing and growing with the patients, doctor. Tell me a little bit, in terms of younger persons, what are the numbers like for us? They are included in that 40,000, yes?
Yes, correct. And as you alluded to, the numbers may be larger than we think. So with regards to the diagnosis of epilepsy, we diagnose it based on a clinical picture. So if a patient has 2 or more what we call unprovoked seizures, more than 24 hours apart. So there are certain conditions where patients may be predisposed to epilepsy, but they may just have provoked seizures. For example, babies in the age group of 6 months to 6 years, they are at higher risk of having what we call fever fits or febrile seizures.
Right.
But that does not necessarily mean that that patient would go on to develop epilepsy. So in addition to epilepsy, we do have other conditions that, around that diagnosis.
Right, so that they may suffer seizures as well.
Correct.
And then could use the same sort of information and awareness that the foundation would bring.
Yes.
Now, we will go into that actual conference because I imagine a lot of the details covered in the conference will help promoting awareness, one thing, but also inform us. But before we do the conference conversation, tell me a little bit as to how we can identify the onset of a seizure, perhaps, so that we can save ourselves or friends or family.
Okay, so seizures are, they manifest themselves differently. So seizures fall into 3 different categories. So you have a generalized seizure, you have a focal seizure, and you have unknown seizures. So the generalized is the one that we all know as the tonic-clonic or the convulsive fits, as we call it in our vernacular.
Right.
And the focal one might be just a daydream. It might appear like a daydream, or that's why it goes most times undetected. So it will call for a very observant parent, teacher, friend to notice that something is happening with this child or adult, as the case might be. So these are the signs that you could look for. Of course, convulsions, rapid movement of the eye, the limbs, or jerking, falling to the ground maybe. Sometimes if it's a focal seizure and the person is staring off into space, sometimes you may not be able to reach them in that 5 to 6 seconds that the seizure may occur. So these are the things that you look for. Sometimes children, they're accused of daydreaming in class when they're actually having focal seizures and it goes undetected.
Now, are there age groups or any sort of demographic specifics where we may see more seizures in a particular group?
No, not really. I don't know if Doc will speak to pediatric neural patients.
Yeah.
Yeah.
So, as you know, every patient's journey with epilepsy will be different. So one patient may have, for example, as Nicole said, the tonic-clonic seizures, the convulsive seizures, and that's the one we all know about, and that's the one we are
identifiable.
Correct. But then there may be patients presenting very early on as a baby where they may just have a little shudder, and that shudder, right, could be very detrimental to that patient's development. So as it continues and continues, that patient would have what we call infantile spasms, and it could affect their development, their learning, and it could be because of a multitude of causes. Yeah, so that's another seizure type that, you know, may go unnoticed because it might present initially as like a little head nod, and you might think, you know, baby's just developing.
Right.
And it presents in the age group where, you know, they're now starting to sit up, they're now starting to roll over. So you think that is, you know, just baby behavior.
Right.
Yeah.
Ooh. So it means that we probably should try to attend this conference to get more information, since we definitely need to pay close attention. It's happening on Sunday, November 24th at the Central Bank Auditorium from 1 to 6 p.m. And I understand that it's free.
It is quite.
Tell me about some of these speakers, some of whom are actually familiar faces, as we've had Dr. Paula Robertson on the show with us. What will they be covering, and what can we look forward to?
Okay, so we have Dr. Vanita Shukla right here. She's our pediatric neurologist, and she's going to be covering epilepsy in children and treatment as well. We have Dr. Paula Robertson. She's going to be talking about fits, faints, and funny turns. So what is that? Sometimes people have funny turn or fits, and it might not be a seizure. It might not be, epilepsy, because not all seizures are epilepsy. So we have Dr. Patrick Knight, he's our neurosurgeon, and we have been doing really, really great work in terms of surgery right here in Trinidad and Tobago. So persons don't have to fly out to the UK or the US anymore. We have our trained neurologist and neurosurgeon right here. So Dr. Patrick Knight is going to be talking about the surgeries that we have covered so far, and he's also going to be able to say, are you a candidate for surgery? Yeah, so if you're a loved one or you're a self-advocate and you come out, you can also have a talk with Dr. Knight to see whether or not you're a candidate for surgery. And we have one more speaker.
Dr. Sherry Sandy.
Dr. Sherry Sandy. And she's going to be talking about adult neurology and epilepsy in adults.
So we're covering all of the age groups, we're giving the information, and this is incredibly free so that everybody is encouraged to come out.
Certainly.
Is there any sort of registration or any online information
we
that
have
we need to share?
online forms that people could go to either our Facebook or Instagram page, and they can sign up online so we can know the numbers, so we don't want to be, you know, overextended.
Yeah. Now, in terms of SAFT's actual endeavors, beyond this conference, we will see more of you all through the month of November, but what else can we look forward to in terms of connectivity or finding you outside of these sorts of endeavors?
So, as I said, we work with the Ministry of Education Student Support Division to carry out what we call our Seizure Smart Lecture. So all through the year, SAFT is not visible on television, but we're doing the groundwork in terms of going into schools to teach seizure recognition, because as I said, we have over 40,000 people living in Trinidad and Tobago with epilepsy, and a lot of them are students. So they present at school. So we go in there to teach the classroom and the teachers and all the stakeholders, everyone involved, how to treat with this child, or sometimes we even had teachers who had seizures as well, how to treat with this person in the event that they would have a seizure on the compound. So that's our main work during the course of the year. And of course, March 26th, Purple Day, Epilepsy Awareness Day, a chance to wear purple, raise funds, and also to educate about seizures and epilepsy.
Well, Nicole, you're saying that it wasn't something that you've been doing on television much, but we hope to see you again. We will continue to support these endeavors, as awareness is the first step, but we're making sure that this November everybody knows that it's Epilepsy Awareness Month, and you can find out more about epilepsy on Sunday the 24th of November at the Central Bank Auditorium with no charge, as they are hosting a conference to educate us all. We thank you very much for your work, and of course for your continued information and work as well, Doctor. Thank you for joining us. And I hope to find a purple outfit to wear on the 26th
I hope
as
so
well.
too, but you can wear a button in the meantime.
Oh yeah, I should put on my button. While I do that, we're going to take a break and come back with even more here on the Now Morning Show. No, Ruckus, you didn't get a button. Hard luck.